Assalamualaikum warahmatullahi wabarakatuh. Today, I would like to present about the comparison studies between dengue fever and dengue hemorrhagic fever on patient in Darul Ehsan Medical Center, Shah Alam, Selangor, Darul Ehsan. Based on the Sun Daily, Selangor has recorded the highest dengue cases with 44,884 dengue cases nationwide from January 1st until December 30th in 2017. What is dengue fever? Dengue fever is a mosquito-borne disease, or also known as a break-bone fever, and it is a viral infection caused by any one of four closely related dengue viruses, which is dengue virus 1, 2, 3, or 4. The virus is transmitted by several species of mosquito within the genus Aedes, principally Aedes aegypti mosquito in the domestic environment. In small proportion of dengue cases, the patient that has a secondary dengue infection or it is infected with a different serotype, the infection are more likely to develop into life-threatening dengue fever called dengue hemorrhagic fever. This is due to a very low platelet count in the patient and causing the blood cell to lyse. As the result, internal bleeding or hemorrhage may occur. In this study, I will use two patients, which is patient A and patient B, to make comparison between dengue fever and dengue hemorrhagic fever. This is patient A. He is a 90 years old male and he has no past history of dengue fever. This is patient B. Patient B is 22 years old male and he has past history of dengue fever. Patient A came to the hospital complaining about sudden onset fever, vomiting, nausea, muscle and joint pain, and also loss of appetite. Physical examination by the doctor shows rashes and pinkish skin due to fever. He has been diagnosed with dengue fever. Patient B came to the hospital complaining about fever, gum and nose bleeding, loss of appetite and vomiting. Physical examination by the doctor showed gum and nose bleeding, pallor due to blood loss, and also rashes around the abdominal area. Diagnosis by the doctor is dengue hemorrhagic fever. Laboratory investigation for patient A include full blood count, dengue antigen and serology test, prothrombin time and activated partial thromboplastin time, and also a liver function test. For full blood count, the results show hemoglobin level has slightly decreased from the day the patient is admitted in the hospital. This condition might cause due to a very poor oxygen supply derived from hemolysis that happen when the platelet count is decreased. White blood count is also decreased. This condition might cause due to bone marrow suppression by the dengue virus and inadequate inflammatory defenses to suppress infection, and this condition has caused humoral immunity to take place. Neutrophil show a high result and lymphocyte is increasing in amount due to increase in body immune system and show a significant viral infection in the patient. For dengue antigen and serology, dengue antigen results show a positive result for antigen detection of dengue virus and negative for dengue IgM and IgG antibody on the first day of patient admitted. NS1 is a highly conserved glycoprotein that is present at high concentration in the sera of dengue infected patient during the early clinical phase of the disease, and NS1 antigen can be formed from the first day up to 9 days after onset on fever in sample of primary or secondary dengue. On the second day, dengue serology show IgM antibody start to produce. This condition indicate patient antibody is starting to produce toward the virus. Patient A prothrombin time show a prolonged result on the first day but increase slowly on the second and third day of the test done, while for activated partial thromboplastin time, the result show a prolonged result, but the result is getting better day by day. For liver function test, total protein and albumin level is show decreasing in amount, and albumin and globulin result is also decreasing. This is because the total protein is low. Alkaline phosphatase is also low. This condition shows a problem in liver. It can be suggested that the patient might have liver disorder due to dengue virus. Liver enzymes such as aspartate transaminase, alanine transaminase, and gamma glutamyl transaminase is also showing an elevated in amount. For patient B, the laboratory investigation include full blood count, dengue antigen and serology tests, activated partial thromboplastin time, and also liver function tests. For full blood count, the PCV is increased due to high fever, suggestion of dehydration, and low availability of oxygen due to poor oxygen supply by the red cell. This condition is derived from the decreasing amount of platelet and cause hemolysis. White blood count is also decreased drastically due to suppression of bone marrow and inadequate inflammatory defenses to suppress infection and cause humoral immunity to take place. Lymphocyte count shows an increasing in amount, and this might due to patients' increased immune system toward virus. Dengue antigen and dengue IgG antibody shows a positive result on the first day of the patient admitted. Dengue antibody result can be interpreted as the patient is having a secondary dengue infection. And for activated partial thromboplastin time, the result shows an irregular prolonged result. Liver function tests show a total protein and albumin level is low. Albumin globulin level is also low. This is because the total protein is low. Alkaline phosphatase show a low level. This condition shows a problem in the liver. It can be suggested that the patient might have a liver disorder due to dengue virus. The transminase enzyme is high, such as aspartate transaminase, alanine transaminase, and gamma glutamyl transaminase. Platelet is always a significant parameter when it comes to dengue fever. Dengue virus is the main cause of suppression in the bone marrow. Since bone marrow is the manufacturing center of the blood cell, its suppression causes deficiency of blood cell, and this condition has led to low platelet counts. It also may derive from the binding of virus to platelet of human blood in presence of virus-specific antibody. When the vascular endothelial cells that has been infected with dengue virus combine with platelet, they tend to destroy platelet. As we know, platelet is a very good clotting factor. When a person is infected, the platelet will decrease due to suppression of bone marrow. And when there are no platelet or large reducing in platelet amount, the bleeding will occur. Clotting process can take place or may be prolonged. Most of the dengue hemorrhagic fever is caused by secondary infection. This is a reason why the patient might have the symptom of bleeding or hemorrhage. However, the alteration in the microvascular endothelium may also lead to higher likelihood of hemorrhage in dengue patient. Another parameter that will be referred is lymphocyte. Not only in dengue fever, all viral infection will increase the number of lymphocytes to produce immunity. This is because lymphocyte is a type of white blood cell that is a part of the immune system. There are two main types of lymphocyte. There are B cell and T cell. The B cell will produce antibodies that are used to attack invading bacteria, toxins, including viruses. In many dengue cases, the liver will be damaged. This might cause from direct viral toxicity or dysregulated immunologic injury in response to the virus. The commonest abnormality detected is the rise in transaminase level. In majority of study, show elevation of AST is more than ALT. This is because AST is released from damaged myocyte. The increase in AST or ALT ratio is useful in differential from acute hepatitis. As a conclusion, both patients show a positive result of dengue and the result has been compared. However, there are not much differences in between dengue fever and dengue hemorrhagic fever. The only differences is patient B is on his secondary infection by another dengue genus, and this might cause him to have hemorrhage or bleeding symptom.